I think it's really important to make sure that this infection is, to remind ourselves, this is not an infection that's limited to the elderly, those in hospitals. We're beginning to see much more C. diff in the community, and we'll have a talk later on today talking about reporting of C. diff. So it's important to make sure that those that are listening, those in the audience, really focus on advocates, whether they be community-based or those that have been diagnosed in the hospital. This is a really unique opportunity to do something that's really important, something that sometimes healthcare providers have a difficulty doing, which is listening. It's my hope today those that are so viciously impacted by this terrible disease can continue to be brave and tell their stories, but more importantly, for them to be brave and present bold ideas and suggestions of ways of making change in terms of reporting, treatment, and guideline development in C. diff. I'm an infectious disease pharmacist by practice. Unfortunately, my commercial colleagues probably tell me I put my hat on too often, which the marketers don't really like. And I actually have a daughter that's going to be graduating from nursing school in 2 weeks, so it's a shameless plug for anyone in the Boston area that wants to hire a graduate nurse in pediatrics. She's a very lovely woman. So we get an opportunity to talk about patients in C. diff, and I, try to make sure she understands all the drug stuff. Understanding that's really not what she is going to be doing, but she got very excited the other day because there was a question on her boards that she's been studying incessant for on C. diff. So she got all excited, but unfortunately she got the question wrong. So I don't know what that says about me as her dad, but it says nothing about her. But I'd also like to congratulate Christian and his staff who completed, working with advocates in their lobby day in April as they continue to educate Congress and other policymakers about C. diff. And one thing that's really important for me to communicate to each of you at Ceres, when I joined about a year ago, we actually, one of the first town halls I was part of, we actually had an advocate impacted by C. diff present. One of the things that I was impressed by is how impactful that individual was, not only in our CEO, but our executive committee. And it really is something at the heart of what Ceres does. You will often hear myself and the CEO discuss patients when we discuss bringing revolutionary microbiome therapy and other therapeutics to the market. So we want to make sure that novel treatments are available for patients and their families with C. diff. And that's something that fuels Ceres every day. So with that brief introduction, I'd like to bring up to the stage Christian Lillis, the Executive Director of the Peggy Lillis Foundation.
So usually I say don't applaud, just throw money. Anyway, I want to join Kenneth in welcoming everyone here to the 2022 National C. diff Advocate Summit. After 2 years of virtual interaction, I am thrilled to be with so many committed to the fight against C. diff and antimicrobial resistant infections. Whether you're one of our amazing advocates, an organization we partner with, one of our incredible presenters, or a representative of one of our sponsors whose generous support makes this summit possible, thank you so much for being with us. I am so grateful for the work you have done and continue to do in the fight against C. diff, the infection that took my mother's life 12 years ago. And while I am genuinely happy to be with you, I am also filled with rage. I have been filled with rage for the past 2 years as COVID-19 has been allowed to run rampant. I suspect many of you share my anger. Being a queer person who came of age in the 1990s, I had not planned to live through a second plague. But having come out in 1989, I vividly remember the callous disregard the federal government and much of our country showed people with HIV and AIDS. In the absence of state help and often rejected by their families, people with AIDS, mostly but not exclusively gay men, rose up. First, they created networks of care and education like GMHC and the San Francisco AIDS Foundation. Then, in the face of continued intransigence from the Reagan and Bush administrations, the AIDS Coalition to Unleash Power, or ACT UP, was founded in 1987. I remember watching the news when I was 15 and seeing ACT UP protest the lack of drug development and later the high cost of those drugs. I participated in several ACT UP actions while I was in college. And ACT UP wasn't alone. Our country has a long history of people rising up of people being fed up and rising up to fight on their own behalf. Our country has a long history of fed up citizens taking action, from clinic defense to abortion to disability rights activists occupying HHS buildings in 1977 to demand civil rights. From the Boston Tea Party to the George Floyd protests, rebellion is in our DNA. So in the spring of 2020, as the Trump administration, former governor of New York, Andrew Cuomo, and Bill de Blasio rejected calls from public health experts to adhere to the precautionary principle and lock down, I was waiting for a response. I waited for a group like ACT UP to coalesce and demand better. It never happened. Now, there are patient advocacy groups for people with long COVID and ones formed by people who lost loved ones to the pandemic. These include Survivor Corps and the Long COVID Alliance. But let me ask you a question. Have you seen any of those people on Fox or CNN or MSNBC? Any representatives of those groups? I'm guessing you haven't. I don't watch cable news, but I read voraciously. Most coverage about COVID-19 features doctors, policymakers, newspaper columnists, and economists. The news is not covering the views of people who've had COVID-19, people battling long COVID, or those who have lost a loved one to COVID. I see this and the rage grows. Now, you may be thinking, this is a summit about C. diff and antimicrobial resistance, so why is Christian talking so much about COVID? COVID is a lens through which we can see how our healthcare and public healthcare systems work. The pandemic revealed how 4 decades of neoliberal economics has distorted the way we develop and provide medical care, and also the decimation of our public health system. It should surprise no one in this room that our society doesn't take the prevention or even treatment of infectious disease very seriously. Many of our country's elites would like us to believe that the SARS-CoV-2 pandemic was a surprise. It wasn't. Epidemiologists have been saying the world was due for a viral pandemic. While COVID has extracted a human and financial cost unseen in over 100 years, we are in an age of pandemics. Over the past 32 years, we have seen an increasing number of infectious disease emergencies, starting with West Nile virus in 1999, onto SARS in 2003, HSN1 in 2004, H1N1 pandemic avian influenza in 2009, MERS in 2012, Ebola in West Africa in 2014, and Zika in 2015. Simmering alongside these pandemics is an absolutely unconscionable rate of healthcare-associated and increasingly antimicrobial resistant infections. In fact, if we look at the record of infectious disease response in my lifetime, that our country bungled COVID isn't that surprising. Many of us in this room have been harmed, directly or indirectly, by a bacterial infection first identified in the 1970s. Nearly 50 years later, progress has been minimal. That doesn't mean dedicated doctors, scientists, public health officials, and many others haven't engaged in Herculean efforts to combat this disease and save lives. They have. But our fragmented and balkanized healthcare system is incredibly hard to change. C. diff was once considered a nuisance disease affecting elderly patients, and additional antibiotic doses cured them. In 1989, there were less than 800 deaths attributable to C. diff. Over the next 7 years, that number would increase 8-fold, with more than 6,225 C. diff-related deaths in 2006. Despite this surge of increasingly deadly C. diff outbreaks, the disease never captured the attention of the media and the public as MRSA had, and Ebola and Zika later would. So under the radar, from 2000 to 2014, the period in which my mother died, cases alone more than doubled amongst Americans under 65. While doctors and scientists at CDC and other organizations noticed this rise, there was no public call to action until after my mother died in 2010 at the age of 56. Like many of you here and many of you watching on the live stream, we hadn't heard of C. diff until our mother was fighting for her life. How can a disease that infects 500,000 Americans every year and kills more people than AIDS or drunk driving be a secret? Well, How have we allowed COVID-19 to go from a novel pathogen to a worldwide pandemic, which we are now being forced, and be clear, we are being forced to accept that it's going to be endemic? It did not have to be this way, and it does not have to be this way. Just like we did not have to allow C. diff to go from claiming 800 lives in 1999 to tens of thousands now. Just like we virtually eliminated measles, smallpox, and polio. What's different now than in 1977, when smallpox was eradicated, is that our country is constantly tearing itself apart because it's profitable and politically expedient for our two political parties. Throughout the pandemic, the rich got richer and the poor got poorer. Two presidential administrations from two different parties managed to screw up basic public health measures. It's easy to blame people, and some of them deserve it. And we've also heard that people were going to follow the science, and they have not. Instead, they have left at every opportunity to downplay the risks, the burden, and the nearly 1 million people who have died from COVID. And the rhetoric they use to achieve this is the same that has been used to excuse people dying from C. diff. Oh, they were elderly. They had a pre-existing condition. They were disabled. It was their time. So I want you to keep in mind these similarities between COVID-19 and C. diff as we spend today together. It doesn't have to be this way. We can make different choices. We can insist that our government and institutions do better. Here are a few things we can and should demand. We need to invest significantly more money in public health at the state and federal level. We spend peanuts on public health, just $285 per person. For comparison, our military budget is more than $2,100 per person. A big part of this investment would be to expand surveillance and reporting of all dangerous pathogens. We have been advocating for C. diff to be added to the list of nationally notifiable diseases. Our friends at the Society for Healthcare Epidemiology of America are asking Congress for $100 million a year to bring the National Healthcare Safety Network, our primary disease reporting tool, up to date. Now, $100 million sounds like a lot of money, but it's 30 cents per American a year. Or $100 for every person that's died of COVID. It's nothing. Don't let the price tag dissuade you. This next part is controversial. We have to embrace mitigation over punishment. Right now, we punish hospitals for having bad infection rates by cutting their reimbursement rates. It's totally counterproductive. Do you punish a child who struggles with math, or do you get them a tutor? Rather than punish hospitals and nursing homes, we could have epidemiologists and infection preventionists examine the root causes of bad outcomes and help facilities fix them. Lastly, you're like, thank God, lastly. Lastly, we have to claim our power as what my friend Tara Montgomery calls health citizens. We live in a democracy. Enormous amounts of our tax dollars go to pay for healthcare, both directly through Medicare, Medicaid, and our insurance premiums, but also through government grants and nonprofit status. Trillions of public dollars fund our healthcare system every year. We should have a say in how it's spent. From this perspective, to quote my friend Tara, we are all citizens of democratic healthcare systems. We participate as co-creators, as stewards, and as stakeholders. We exercise our democratic right to provide input into policy, priorities, allocation of resources, and advocate for the public good. We expect transparency and truthful information. We exercise our social rights, our consumer rights, and our privacy rights. We believe in progress. We know we are assets and not liabilities. As we listen today to our presenters and panelists, I want you to think about what they're saying from the perspective of a health citizen. Because like measles, polio, and smallpox, we can end the harm caused by C. diff and antimicrobial resistant infections. But we have to do it. We have to tell our elected officials what we want. We have to tell the FDA, the CDC, what C. diff patients need. We have to demand a seat at the table when guidelines are being developed. We have to do all these things because no one else is going to do them. All right, enough of my ranting. Though I did mean all of that. I'm going to hold you to it. Before I introduce our next speaker, we have people to thank. First, I want to thank everybody in this room and everybody who's joining us on the live stream. To all our advocates and speakers who traveled near and far amidst the lingering pandemic to be here today. More than 12 years into this fight, my mom remains my North Star, but each of you inspire and rejuvenate me. Each of you inspire and rejuvenate the fight in me. Our deepest thanks to Series Therapeutics for being the lead sponsor of our 2022 National C. diff Advocate Summit. We are also incredibly grateful to Ferring Pharmaceuticals and Pfizer for their generous support. Thank you to Finch and the Pew Charitable Trust for their long-term partnership. Last but never ever least, a hearty thank you to Summit Therapeutics and to Tech Lab. And now we're going to kick the program off with our first presenter, Mr. Kenyon Farrow.